So Shelter Movers offers free moving and free storage to women and children fleeing abuse. Our volunteers and staff operate in Vancouver and Toronto, Ottawa, and Halifax. And now what we've seen with the pandemic is expressions of interest from more communities across Canada asking how, as you say, Rhiannon, is Shelter Movers still operating? Are we still helping women flee? The answer is yes. We're moving about 60 families a month at the moment, which is on par with any other day. And what we're hearing are the types of calls that we're getting are slightly different. So these are elevated risk situations. And I think when we think of survivors and their experience, as I think, Paulette, you very rightly pointed out, it's very tempting to simplify a survivor's experience. And I think the important point that we remember at Shelter Movers is the diversity of experiences of the people we serve. Women with disabilities, Indigenous women, newcomers, the wealthy, the not so wealthy, they're all experiencing this in a different way, and how they ask for help and where they ask for help will be very different as well. But I think to your point, Samra, reliability is very important. And so we've spent a lot of time now updating our procedures and making sure that our volunteers are operating in a safe environment. So we have PPE for all of our volunteers, and yes, it's expensive, and yes, it's hard to find. But if we're going to offer a reliable service to help women and their children flee, we need to do it in a way that keeps them safe and keeps our own people safe. So I would say the experience of women in rural communities is really weighing on me personally a lot these days. We know that women have, survivors have fewer resources in rural areas, greater fear of a lack of confidentiality. If you do ask for help and you jump in a car with someone, hopefully they're keeping your privacy secure. Shelter Movers spends a lot of time maintaining safety, and not just the physical safety, but the information safety and information privacy of the families we're serving. And so we get a lot of calls asking about that as well. But 60 families a month is 60 families a month. And I think our volunteers are doing what they can. They're putting themselves at risk. I think we can all agree that frontline healthcare workers are critical to us getting through the pandemic. I would urge folks to remember the frontline non-healthcare workers who are also, as you said, Samra, in people's homes. We're on our hands and knees getting the children's toys out from under the bed, and we've got our masks on, and we're covering our faces, and we're washing our hands. And these are people who are not getting paid to do this. They're doing it because it's the right thing to do. They're doing it because their neighbors need them. And I really applaud them and what they're doing. So this is, I hope I can offer some frontline perspective to our discussion today, and that would be an example of that.
Thank you.